Inanunsyo ng World Health Organization itong Miyerkules na bukod sa proteksyon sa malalang epekto ng COVID-19 sa tao, ang COVID-19 vaccine ay nakatutulong din upang mabawasan ang transmission o pagkalat ng Delta variant ng nasa 40%. Kasabay nito ang babala sa publiko kaugnay sa maling sense of security kaugnay sa bakuna. Sinabi ni World Health Organization Director General Tedros Adhanom Ghebreyesus, marami sa mga bakunado na ang may mali ang pag-iisip, tulad ng kapag may bakuna ay hindi na kailangang mag-ingat.
We're concerned about the false sense of security that vaccines have ended the pandemic and that people who are vaccinated do not need to take any other precautions. Vaccines save lives, but they do not fully prevent transmission. Data suggests that before the arrival of the Delta variant, vaccines reduce transmission by about 60%. With Delta, that has dropped to about 40%. If you're vaccinated, you have a much lower risk of severe disease and death. But you're still at risk of being infected and of infecting others. We cannot say this clearly enough. Even if you're vaccinated, continue to take precautions to prevent becoming infected yourself and to infecting someone else who could die. That means wearing a mask, maintaining distance, avoiding crowds, and meeting others outside if you can, or in a well-ventilated space inside. And we continue to call on all governments to implement a comprehensive and tailored approach of public health and social measures to prevent transmission, take the pressure off health systems, and save lives. And it's vital that countries get patients that need care into the clinical care pathway earlier. That applies to all countries in all situations.
Ayon sa WHO, dapat pa ring sumunod sa mga safety health measures upang maiwasang tamaan at maipasa ang virus. Iginit din ni Tedros na hindi ganoon kaepektibo ang bakuna laban sa transmission, lalo na sa mas nakahawang Delta variant. Dagdag pa niya, maaring makapagsalba ng buhay ang bakuna pero hindi nito tuluyang naiiwasan ang transmission ng virus. Ayon umano sa datos, bago dumating ang Delta variant, nabawasan ng 60% ang transmission pero bumaba ito ng 40% dahil sa Delta. Ang variant na ito ang nagdodomina ngayon sa buong mundo at dinaig ang ibang strains ng COVID-19. Dagdag pa ng WHO, kung bakunado ang isang individual, mas mababa ang risk ng malalang sakit at kamatayan. Ngunit nandyan pa rin ang banta na muling mahawa at makahawa ng iba, kaya naman dapat ipagpatuloy ang pag-iingat. Ibig sabihin, kailangan pa rin ang pagsusuot ng face mask, pagsunod sa distancing at pag-iwas sa mga matataong lugar. Ang matindi pang kalaban daw ngayon ay ang pagiging kampante. Kailangan daw kilalanin na may banta pa rin ang virus sa paligid, kaya kailangan paigtingin ang mga hakbang upang patuloy na mapababa ang COVID-19 transmission.
Probably our worst enemy right now is complacency, just becoming too comfortable with the situation we're in. I think everyone has understandably wants to get back to the lives which we're doing, back to school, back to college, back to work. But that doesn't mean we won't have pockets of under-vaccinated people. The real impact of the pandemic will be amongst the unvaccinated. So we need to focus not just on making sure we're going back to those people who've been hesitant about vaccine, finding pockets of people, communities who've been missed, individuals who've been missed, and continuing to sell a positive message about vaccination and persuading and convincing people to get vaccinated, especially in the Northern Hemisphere before the winter period, because we know what happened last year. We know that people will move inside, but we just need to recommit ourselves to recognizing there's still a dangerous virus around, and that we need to take our best action to continue to drive transmission down. The biggest tragedy still in this pandemic is the inequity in vaccine distribution. It really and truly is. And with that, the inequity in oxygen availability and the inequities in PPE, these are the things that have driven the inequality. But vaccines is particularly stark given what we see with their impact.
Samantala, para sa mga di pa nababakunahan, magsasagawa ng massive vaccination drive ang Department of Health sa November 29 hanggang December 1. Aabot daw sa 1.5 million katao sa Central Luzon ang target na mabigyan ng bakuna sa loob ng nasabing araw na tinaguri ang National Vaccination Days. Jennifer Salenga, CLTV News.